If you're exploring ketamine therapy, you've probably noticed it comes in a few different forms. Hi, I'm Dr. David, and I am the founder of NutraBrain Clinic and the former founder of the Ketamine Healing Clinic of Los Angeles and Orange County. So we have the nasal form, we have the troche, and we have the rapidly dissolving tablet. The key idea is how to get ketamine into your system with the most absorption and the fastest. Now, ketamine nasal spray actually has the greatest bioavailability. What does bioavailability mean? It means the amount or the percentage of medication that actually gets into your system compared to what you're taking, okay? Now, the spray has the most bioavailability compared to the troche and the tablet, the rapidly dissolving tablet. It does not have higher bioavailability than the IV form or the intramuscular form, okay? The whole purpose of at-home ketamine is for convenience, to save money, and essentially to have chronic care without breaking the bank, okay? Now, the nasal spray allows for amazing microdosing, all right? You can use it throughout the day, one spray at a time, 4 sprays at a time, depending on your tolerance, and it doesn't last that long, so you get the effects, the anti-anxiety effects, and the antidepressant effects without being essentially knocked out. Now, we have the troche. What is a troche? A troche is something that's covered in a substance that allows it to dissolve slowly and then last in the system a bit longer. If you're looking for an experience at home, something to approximate the IV infusion, the troche is the way to go. I can prescribe it up to 250 milligrams, and you will get an experience with that many milligrams, okay? You often don't need more, but there are a few patients that do. And then we have the RDT, rapidly dissolving tablet. That is dissolved faster, okay, under the tongue, and it wears off faster. So that is a great option for people who want to use the oral form but don't want to dissociate for a long period of time, okay? We also have the sublingual droplets. Now, those are kind of similar to the RDT. They will kick in faster than the troche and maybe almost as fast as the nasal spray. But the sublingual droplets are not that often used or prescribed, so I would kind of stay away from those for now until we have more experience with it. There are a few companies that are offering subcutaneous injections, or one company, subcutaneous injections for at-home use. I do not recommend that. That can be dangerous. And a subcutaneous, intramuscular, or IV route of administration for ketamine should only be undertaken at a clinic, okay? The nasal spray has proven to be a game changer for most of my patients. And again, I've been prescribing ketamine since 2014, so for 12 years now. And the reason is the nasal passageway has a lot of blood vessels and is very vascular. So when you use the spray there, it gets absorbed into the mucosa and the capillaries there. Keep in mind, the nasal spray is not an inhalational modality. You're not trying to inhale the spray. You're actually going to angle it when you spray it in your nose so it can be absorbed in your mucosa. If you have any questions about ketamine or the ketamine nasal spray, please text or call us 818-570-1640. You can also go on my website at NutraBrainClinic.com. That's NUTRA brainclinic.com. Thank you for listening.